Hi, I'm Dr. Lawball from Back to Health. And in this video, we're going to go through a series of warm-up exercises for your feet to be done every single morning before you even stand up out of bed. Now, one of the most important strategies we're going to utilize in trying to recover from acute foot pain is making sure that our feet are always supported. And what I mean by that is we want to be in some supportive footwear like sneakers or house slippers at all times. We want to avoid being barefoot as much as we possibly can. So you'll notice here, I've got a set of sneakers sitting right next to me, and I would advocate for you to keep a pair of slippers or a pair of sneakers right next to your bedside. Let's go ahead and get started. The first exercise we're going to do is called splay and scrunch. With the splay and scrunch exercise, all we're going to do is we're going to scrunch our toes up, contracting that medial arch, and then extend the toes out, stretching that medial arch. Very gently, stimulating some blood flow, waking those muscles up after a long slumber. Just getting them nice and warmed up here. Once we feel like we've done this for about 30 seconds or so, we'll move into ankle flexion and extension. Same concept, we're just incorporating the ankles here now. You might feel this up in your calves or along the front of your shin, down into your Achilles tendon attachment. When you push the feet out, go ahead and scrunch the toes, and when you pull the feet back up towards your nose, go ahead and splay those toes out. Push them down, pull them up. We'll do this for 30 seconds. We're going to switch around and have a seat on the edge of the bed, and we're going to enter into what's called the anterior tibialis stretch. This stretch is designed to stretch the muscles on the top of your foot, outside of your ankle, and up the front of your shin. So to do this, we'll take that foot and pull it up towards our chest till we really feel that nice stretch moving up the front of our shin. Now, one of the things you may have been told or seen to do with plantar fasciitis is to stretch aggressively the bottom of your foot. Do not do this. Do not grab your heel, do not grab the ball of your foot and pull them apart. Instead, we want to do the opposite. We want to pull the foot up towards our chest to get a stretch on the top of our foot and up the front of our shin. The next thing we'll go into is called heel and toe lifts. We're not applying a lot of pressure to our heel. We're not applying a lot of pressure to our foot, to our toes. We're simply going through the movement, contracting the muscles, getting some blood flow going there, getting our feet ready to bear some weight when we eventually do stand up. We'll do this move for about, again, 30 seconds. Do you feel like those muscles have been warmed up? Now, anytime you're going through any of these movements, if you feel like you get some cramping, just stop and shake your foot out and enter back into the movements. The next one we're going to do is called seated toe extender stretches. This can be a little difficult in the beginning. You're more than likely going to get some cramping in your foot when you do this, but slide out to the edge of your bed, tuck those toes up underneath, and apply some gentle pressure. You really should feel a good stretch across the top of your foot, up to the front of your shin. Back out of the stretch a little bit if you get some cramping, and re-enter back into it. You can move your foot at different angles to apply pressure over your big toe, over the middle of your toes, or on the outside little pinky toe. Again, 30 to 45 seconds. Next, we'll break out our roller. Now with the roller, I like a roller that's got a little texture to it. This one's got little bumps on it. We'll place our medial arch over top of the roller and start moving back and forth. We can do nice long strokes encompassing the entire bottom of our foot. Roll your foot around to catch the outside of the foot, catch a little more on the inside of the foot. If you find that sore spot, don't be afraid to roll over it. You may not want to go overly aggressive here, but just enough to warm the muscles up, stimulate a little bit of blood flow. We could do this for a minute or two. If it feels good, do it for 3 minutes. But roll that foot out. Don't be afraid to hit the sore spots. You can also use one of these little spiky balls that you can get on the internet. Again, they've got a little texture to them. And moving them around underneath your foot, hitting the sore spots, hitting all the muscles, warming up the entire bottom of your foot underneath your heel pad. Now, as I mentioned earlier in the video, one of the most important strategies we're going to use in the early phases of recovering from foot pain is avoiding from walking around barefoot or standing barefoot as much as we possibly can. So at this time, I'm gonna go ahead and I'm gonna put my sneakers on before I even stand up. So now that we got our shoes on and we stand up, we're gonna do just a few standing stretches. We're gonna do what's called a gastrocnemius stretch, a soleus stretch, and a split hamstring stretch. The gastroc and the soleus look very similar, and we're gonna get into a position for those. So what we're gonna do is we're gonna find a wall, something we can lean up against, and we're gonna leave the affected foot, we'll say her right foot is the one that's bugging her. We'll leave that back, and we're gonna step the left foot forward. Put a little bend in the left knee, and we're gonna keep this right leg nice and straight. Now, if she had to, she could actually pick that left foot up off the ground. Very little weight on that front foot. And what we're looking for here by bending the front knee and keeping the back leg straight is we're looking for a nice stretch as she leans towards the wall right here in that calf muscle. Now, very importantly, you'll notice that her back heel is not coming off the ground at all. We want to keep that back heel on the ground. We're going to lean forward until we get a nice stretch in the back of the calf here. We'll hold this position for about 20 to 30 seconds. Now, this is the gastrocnemius stretch. We're going to switch now into the soleus stretch, which is very easy because it's in the same exact position. The only thing that changes is this back leg right here. We're going to go ahead and put a little bit of a bend in that knee. So we're going to bend that knee down towards the ground. We're going to bend it until we start feeling a slightly different stretch that you will likely feel a little closer down here to the attachment of your Achilles tendon. You may also, with the soleus stretch, you may also feel a little bit of increased pressure around the front of the ankle joint. That's okay. Again, with all of these stretches, we want to push into them to the point where we get the stretch. We want to do this at least in the mornings, if not a couple to a few times throughout the day. So let's keep in mind, we're not trying to get it all done in one day or one session of stretching. It's consistency over a period of time. Very good. Now, once we get the gastroc done and we get the soleus done, the next thing we're going to do is we're going to do a split hamstring stretch. So for this, I'm going to have Dr. Betts just turn and face the camera. We're going to take the affected foot. Again, we're going to pretend it's her right foot. We're going to step that forward. Very good. Step it forward a little bit more for me. Excellent. Maybe just a little bit more. Good. And then what she's going to do is she's like a pair of scissors right here. So both of her legs are nice and straight. Okay. And she's going to reach up overhead. Excellent. And she's going to bend forward like she's going to drive her chest down to her knee. Excellent. Now, where she should be feeling this is on the back of the right leg here. So we're going to keep that leg nice and straight. Good. And feel that nice stretch on the back of that right leg. Feel it there? Okay. Couple of points here. When we get into this position, you're going to feel that nice stretch in the back of your right leg. I want you to take that left hip here, and I want you to take the left hip and try to turn it down towards your right foot. Feel how that just kind of puts a little bit of added tension on that hamstring? Excellent. Now, you may be able to go down as far as touching your shin, maybe even touching your ankle. But if you're all the way up here and you're just kind of putting some pressure on your knee, that's okay too. A lot of patients have very tight hamstrings. We're going to hold this stretch for about 20 to 30 seconds. And then come on up. And that completes our standing stretches.